Ashley Luno, and this week I will be doing my health assessment for Advanced Health Assessment NU650 on Mr. Scott Walters. I will be doing it on head, eyes, ears, nose, mouth, and throat. And Scott, do you give me your consent to be videotaped today?
I do give my consent to be videotaped.
All right, we're going to start with examining your head, and I'm going to need you for this procedure to just be sitting comfortable, looking straight ahead.
Okay.
I'm basically looking at the contour of your head just to see if it's symmetric, there aren't any scars, no lesions, and it's okay for me to touch you?
Yes.
Excellent. All right, I'm just looking, there aren't any bumps, bruises, scars, lesions, and it appears that your head is normal size for your body of a 36-year-old man. All right. And do you have any questions or concerns about your head or your hair or anything like that for today?
This is turning a little gray, but other than that, I'm doing well.
Okay, that's to be expected. All right, and it appears that your facial features match what you're saying, so completely symmetric and it's great. All right, so now I've noticed you don't have any involuntary movements, you don't have any twitches in your face or anything like that, so it appears that your head assessment is pretty good. We're going to switch to your eyes now. So for this, it's going to be a little bit more involved with you. I'm going to just start by looking at your eyebrows appear to be symmetric to each other and your face. You have a separation in them, your eyelids, can you close your eyes for me and then open? Perfect, so you can close and you can open them both. And they fall slightly over your pupil and your iris, so that's normal. Everything's great there. No pain or anything in your eyesight, no problems with your eyesight?
No, ma'am.
All right. And I just want to make sure, this test is for glaucoma, and basically I'm going to come with this pen light. It's very small, it won't hurt at all. Going to come from the side of it, and I'm looking for any reflection over it. So I'm going to have you look straight ahead. And there's no opacities or anything like that in your cornea or your iris. Great, and your other one. Excellent. All right, I want to look at your sclera, basically the white part of your eye. Just want to see if there are any discolorations or scarring or anything like that. So I'm going to touch your face and I'm going to look up like this and I'm going to have you look down for me. All right, perfect. It's white, no redness. All right, I'm going to have you look up now. Excellent, perfect. To the sides and other side. Great. All right. Now, next thing I'm going to have you do is I'm going to test your visual acuity. So for this, have you ever heard the word Snellen chart?
Not exactly.
Okay, so what it's going to do is a bunch of letters up on a piece of paper, and I'm going to have you stand. I'm going to have you cover your eye with this card, and I want you to read the smallest lettering that you can possible. Okay. All right, and it's just testing your visual acuity, how far you can see. And there's usually, have you ever heard the phrase 20/20?
Yes.
So the first number is where you'll be standing. So it's at 20 feet, all right?
Okay.
And then the bottom number is what a normal eye could read at that feet. So it's basically saying what you can read according to a normal person standing at the same space. All right, so I'm gonna have you stand up. That chart is over here.
Okay.
And let's start with testing your right eye. So I want you to cover your left eye and just read what the smallest lettering that you can.
LFDP.
Okay. And let's switch over to your other eye.
Okay. LPED.
Can you go any lower?
PECFD.
Excellent. All right. So your left eye is a little bit stronger.
Yep.
All right, I'll have you take a seat. For this next one, I'm gonna test your pupillary light response. So it's gonna be shining that pen light in your eye again, but it's gonna be direct and it's consensual. So what I'm gonna do is I'm gonna turn the lights off for a quick moment, and then I'm gonna shine this light into your right eye, and that's gonna be the direct light, and then I'm gonna bring it over to your left eye to see the consensual. So basically what I'm looking for is for your eye to constrict.
Okay.
And then that's direct with the pen light. And then your left eye is going to have consensual, so it's reacting to your right eye.
Okay.
So I'm going to shut these lights off momentarily. All right. So have you look straight ahead. Excellent. And to your next one. Great job. So they both constricted, so that was great. That's what they were supposed to do. So we're gonna test we're gonna do a lot of work on your pupils, okay?
Okay.
You're doing okay?
Yeah, I'm
All
doing
right,
great.
So we're gonna do it's called testing for accommodation. So what I'm gonna do is I'm gonna take this pencil and I'm gonna hold it right in front of you. And I want you to focus on it and then look in the back of it, not on the pencil. So look at this and then look at the wall behind it. And I'm basically looking for your pupil to constrict. Excellent. Great. So a lot of times we test visual eyesight with confrontation. So basically with that, it's saying that we're looking for, it's an earlier detection of lesions for any anterior or posterior visual pathways. So what I'm going to do with that is I'm basically pretending there's a giant balloon around your head.
Mm-hmm.
And what I'm going to do is I'm going to have my fingers come in from the peripheral, and I want you to tell me when you first see them, okay?
Okay.
So I'm going to have you look straight ahead, and you let me know.
Okay.
And on both sides or just one?
Both sides.
Okay,
Okay, right there.
perfect.
Okay. 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 Okay.
Great. All right. This next test is called the kinetic red target test. And it's also just, I'm going to use, similar to my fingertips, I'm going to use this red tipped pin. All right, pretty tiny, but you can see the red, right?
Yes.
I'm going to do the same bubble around your head, but I want you to tell me when you can see this red.
Okay.
When you can see that it's red.
Okay. 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 Okay.
Excellent. All right. So the next, it's the extraocular movements. It's basically testing your ocular alignments of your muscles in your eyes. So what I'm going to do is I'm just going to shine a light, and I want you to look directly at it.
Okay.
All right? What I'm looking for is for a reflection right in your pupils that are closer to your nose. Look directly at the light. Excellent. Perfect. And there's no eyelid. All right. Now, I'm going to have you look at this pencil. I'm going to look at the extraocular movements of your eyes. I'm going to have you look right at this pencil, I'm going to move it in an H movement. Perfect. And no pain with that?
No, man.
All right. So this next test, I don't know if you've ever heard the word nystagmus. It's kind of oscillating in your eye movements. Have you ever heard of that?
No, ma'am.
Okay. So basically what I'm going to have you do is I'm going to have you follow this pen, but I'm going to look for a slight shaking in you, oscillating or shaking in your eye. Great. And follow that. Excellent. All right. Great. And the final test for that is it's called a convergence test. So usually your eye can follow something that's going towards your face about 5 to 8 centimeters. So I'm going to have you look at this pen, and I want you to keep looking at it until your eyes cross, or you feel like that's hard to look at. Great job. Perfect. All right. Now I'm going to use my ophthalmoscope. So I don't know if you've ever had an eye exam before, but it looks like this, and I'm going to look inside of your eye.
Okay.
All right. So for that, I have to turn off the lights. And
Okay.
do you feel like you're in a comfortable position?
Yep.
Okay. All right, so with my ophthalmoscope, I'm going to basically use about 80% of power. I don't want your eyes to constrict at all. And I'm going to use diopter 0. So I'm going to look at your right eye first, Scott.
Okay.
I'm going to use my own right eye. And I'm going to come in about 20 degrees angle. And I'm looking for your red reflex, which is basically a red hue or an orange glow. Okay?
Okay.
And I see it. So now that I see it, I'm going to come in about 15 degrees to your eye. It's going to feel pretty close. And I'm looking for your optic disc, which is an orange yellowish gray, which I see. And your optic disc looks to be, right, it's yellowish orange. And your optic cup is a normal size. It's usually the ratio between your optic cup and your optic disc is about a 1 to 3. And I'm looking around, and the arteries appear to be a lighter red, and your veins appear to be a darker red, which are about 2/3 to 3/4 larger than your arteries. No papilledema. No lesions. I don't see any scarring. I'm going to move over laterally and see your fovea and the kind of a reflection in your macula. Great. All right, I'm going to do the same thing in your left eye. Do you want to break quickly?
No, I'm all set.
All right. Okay. I'm going to switch over to my left eye as well. Again, just perfect. I see your red reflex. Excellent. Great job. All right, I'm going to turn those lights back on. All right. So for that, we are done with your eyes. You can take a break with your eyes. I'm going to switch to your ears.
Okay.
Are you still doing okay?
Yep, doing perfect.
All right. So for that, I'm going to switch a few tools. All right, perfect. Now I'm just first going to look at your ears.
Okay.
They're called oracles. I'm just going to look at them. They appear to be symmetric on both sides. Doesn't hurt.
No, ma'am.
I'm going to touch your tragus. This doesn't hurt.
No, ma'am.
Okay. Your mastoid right here, if it was sensitive, it could be mastoiditis, but this doesn't hurt at all.
No, ma'am.
Okay. There doesn't appear to be anything that is drainage or exudates on either side, which is good. Intact. Excellent. So, I'm going to now use my otoscope. This is going to look inside of your ear.
Okay.
I'm just going to see if there are any lesions, exudate, anything. I just want to look inside of your ear. So I'm going to start with your right first.
Okay.
And I'm gently going to, for adults, I'm going to pull up and back. And I'm just going to take a look in. And I chose one that was the largest one possible for your ear. Great, and it's a pearly gray, which is exactly what it's supposed to be. No lesions, no exits, no. It's very clear. I'm going to switch over to your left.
Okay.
Same. I'm going to pull up and back. And again, pearly gray. No pain with that?
No, ma'am.
All right. So, I'm going to do some auditory tests. So that's some hearing tests. So what I'm going to do first is, have you ever heard of the whisper test?
No, ma'am.
It's pretty, so it's exactly what it means. I'm going to have you cover one ear,
Okay.
and I'm just going to stand behind you,
Okay.
okay? And I'm going to whisper something, and you tell me exactly what you hear.
Okay.
It's going to be it's going to be a combination of letters and numbers, just 3 of them, okay?
SF6.
Correct. All right, I'm going to have you cover your other ear.
Eight, 2, 3.
Great job. All right, so for these next tests, they're kind of special, and this would be for if I had a tuning fork. And this is one is called a Weber test and one is called a Rene test. So the Weber test is testing for if you had any hearing loss, it would be to decide if it was neurosensory or conductive.
Okay.
So what I would use is a tuning fork, and I would kind of hit it like this, and it would start to vibrate. And I would put it at the top of your head with you looking forward. And basically I would ask you if you can hear it in one ear or the other or in both. It's kind of looking for lateralization. I'm looking for you to say that you hear it in both. So it's going to both ears. Mm-hmm. If it went more towards one ear or the other, then we have a hearing loss in one ear.
Okay.
All right. That is the Weber test.
Okay.
The next test is the Rene test, and basically it's looking at bone conduction and air conduction. So when you hear something, it lasts longer with air conduction than it does with bone. So I would hit the tuning fork again. I would put it on your mastoid right here, and I would ask you to tell me when you stopped hearing it.
Mm-hmm.
And then with the U facing towards your ear of the tuning fork, I would put it by your ear, right in front of the air, in front of your ear, and you would hear it longer, and you would tell me when it would stop. And that would see the difference between your bone conduction and your air conduction of hearing. All right?
Okay.
All right. So we're done with your ears. We're going to switch to your nose.
Okay.
Okay?
All right.
All right. So it looks to me that it's symmetric. Have you ever had any injury to your nose?
Broke my nose playing soccer and in taekwondo a couple times throughout my life, but Not recently.
No surgeries on it or anything?
No, ma'am.
Perfect. The color is normal. There's no deformity. I'm just going to feel it. Doesn't hurt at all.
No, ma'am.
All right. Perfect. And I just want to see if there's any obstruction. I'm just going to close one there. Just breathe for me. And it's fine, right?
Yes, ma'am.
And the other. Great. All right, so I am going to use this otoscope again to look inside of your nose just to see if there are any lesions or deformities or anything like that. So I'm going to gently push up on your nose. I'm going to have you tilt your head back a little bit. Just turn this back on. I'm going to do your right one first. Excellent. And it looks like usually your nasal mucosa is redder than your mouth mucosa, and your nose is perfect. I'm going to switch to your left. I'm going to have my hand tilted like this. Excellent. No lesions, no deformities. All right. The last thing I'm going to do with your nose, I'm going to use your sinuses. So I'm going to just press on your frontal sinuses. Just tell me if you have any pain. Make sure that I don't hurt your eyes. Any pain there?
No, ma'am.
All right. And then your maxillary sinuses. Any pain?
No, ma'am.
No problem with sinus?
No, ma'am.
Anything at all? Perfect. No tenderness. All right. Okay, to test your sense of smell, I'm just gonna have something underneath your nose. Tell me if you can smell it. I'm gonna have you close your eyes for me. And I'm just gonna put it underneath your nose. Tell me if you can smell it.
Yes.
And what is it?
I believe it's lilac.
Perfect. And that it is. All right. Your nose is done. I'm going to switch to your mouth.
Okay.
And I am going to put on gloves just because I will be touching your tongue and your teeth. Is that okay with you?
Yes, ma'am.
All right. Perfect. So I am noticing that your lips are perfect. They're red. They are moist. They don't have any lesions. No dry, anything like that. Any pain?
No, ma'am.
Okay. So I am just going to look inside your mouth. I do have this tongue blade that I am going to look around. I'll have you lean back for me, just with your head. Perfect. And open your mouth. Great. Nice and red, no white lesions. No scarring. Your palate appears to be no whiteness at that at all. I am going to feel your teeth just to see if there are any looseness. Your gums are nice and pink. Any pain when I touch your teeth?
Oh,
All right. Excellent. All right, so I'm just going to look at your tongue just to see the coloring, if there's any raised bumps or anything. I'm also going to look underneath at the bottom of your mouth and at the bottom of your tongue. So I am going to use this 4x4. So I'm going to have you open your mouth and stick out your tongue so it looks like it's red. Not any raised white bumps. Great. Symmetric. All right, so I'm going to use this and we'll look at the bottom. Stick your tongue out. Excellent. No lesions. And to the other side. Great. All right, perfect. There. And then just going to have you, I'm going to put this tongue blade on your tongue and I'm going to look at your uvula and have you say ah for me. So
okay.
Open your mouth and say ah. And good. So it raises and your tonsils are not touching at all. Perfect. I'm going to dispose of that. All right, so for our final thing, we're going to do your neck. So I am going to be feeling your neck a little bit.
Okay.
All right, so just by inspection, I don't see any scarring, no deformities, no tenderness, right?
No, ma'am.
Okay. Doesn't appear to be any visible lymph nodes, carotids, nothing like that. All right, so I am gonna palpate all of your lymph nodes around your neck.
Okay.
All right, there's your preocular, just to see if I can feel them. Your posterior ocular, your occipital, your tonsillar, your submandibular, your submental, superficial cervical, your deep cervical, your posterior cervical, and your supraclavicular. No tenderness.
No, ma'am.
I don't feel any hardness. They aren't raised. They're small. They're mobile. They're pretty discreet and non-tender, as you say. All right. I am going to look at your trachea, right in the center of your throat.
Okay.
And I'm going to use this pen just to see where it is, just to see if there's any deviation. I'm going to have you look up for me, and I'm going to come over your chin. I'm going to feel, appears to be even spaces between your trachea and your sternocleidomastoid. No tenderness. I don't see any deviation at all. Perfect. All right, I'm going to see your trachea. Go ahead and lower your head for me. All right, so now looking at your thyroid gland, I'm going to have you swallow for me. And I can see that it raises and then goes back down. And then swallow for me again. Raises and goes back down. Just watching for your thyroid to go up, down, and it's symmetric. All right. So I'm going to ask you to flex your neck slightly, and I'm going to place my fingers on your neck below your cricoid, so that's below your thyroid. And I'm going to ask you to sip a glass of water. And basically what I'm going to do is I'm feeling for your thyroid to raise up. And I'm going to push it a little bit to the side just to see if there are any deformities or anything like that.
Okay.
All right. So here's a glass of water. All right, and I'm going to place my hands right below your cricoid. Go ahead and take that drink. I'm going to push it slightly to the right. Great. And stop. And then once more, I'm going to push to the other side. Go ahead. Excellent. Great job. All right. Thank you. And that is the completion of head, neck, eyes, ears, nose, mouth, and throat.